What's up, guys, and how is everybody doing out there? Man, it's been a week already since I arrived in the United States of America. 3 more weeks to go. Time is just flying by, right? Flying by. Spending time with family, visiting friends. The usual things you do when you come back home. An update. Let's do an update, shall we, on my medical issue, because if you guys aren't aware of it, I returned back to the States because there's some medical issues that I need to take care of. Let's see, where do we start? I guess we start from the beginning, right? Monday I went up to see my doctor. Stopped at the office. He said, oh, he's no longer here. He grouped together with another physician, and they're up the road. He said, just head on up the road. And the lady gave me the new address, so I went up there. I might have said this in the last video, but I got in there. Everybody's wearing masks, and turned to the one lady and I said, are masks required? She's like, yeah. So I'm like, all right, so let me leave and let me just give him a call. So I left there, came home, called the doctor's office. Hi, I'm calling Dr. Harrison. I'd like to get in, I'd like to get in and see him. When can I get in to see him? 'Cause in the past, if I had a problem and it was like an emergency, they had slots available throughout the day and throughout the week. That, okay, come on in at whatever, Monday at 4 o'clock, doctor will see you. I'm like, good to go. Well, lady says to me, well, what's your name? Gave her my name. What's your birth date? Gave her my birth date. She goes, well, you are considered a new patient. I said, what? I said, how can it be a new patient? You're looking at my file. She goes, no. When the doctor moved and joined together with the other doctor, if you hadn't been seen in so long, they deem you now as a new patient. Wipe out 20 plus years of seeing my doctor, I am now a new patient. So I said, all right. I said, well, I'll be a new patient. How can I get in to see him? Sorry, sir. There's the old sorry, sir. He is not accepting any new patients. Like, what? How can I see my doctor? What are you going to do? 20 plus years wiped out. Now, if I was able to go in, speak directly to my doctor, 50-50 chance he'd have said, yeah, come on in. Boom. You're a patient. But anyways, they said, since I haven't been seen in since 2016, I'm considered a new patient. What they do, I've learned from talking to quite a few people, doctors now, you better go see them within a year. I don't care what it is. Hey, doc, I'm here. Or if you're on medication, they want you to come see it to see how you're doing and what medication you're on and how it's affecting your body and any changes. And so they want you to come in. Hey, doc, I'm here. Okay, go in and see the doctor. Here's my insurance card. Okay, I bill the insurance card. We're good for another year. The insurance is paid for. Whoop, out the door you go. So I couldn't see my doctor. So I'm like, all right, now what? So I had friends and my mom and her friends and all them. They're like, oh, go see this doctor. Go see this doctor. My mom went down to her doctor. Said, can you get him in? Will you accept him as a new patient? Yes, we will accept him as a new patient. However, you're looking about a month and a half to 2 months out before the doctor can see you. Huh? So am I supposed to die before the doctor can see me? So you can go down here to St. Luke's. No affiliation, I was told, with St. Luke's in Manila. Go down to St. Luke's, the in and out care facility. All right, cool. Run down there. One down there. Hello, I'm here to see a doctor. Here's my problem. Can you help me? Yes. However, here's what they do. You walk in, I have this issue, I have this problem. Okay. We'll give you medication for the issue you're having. We're not curing it. We're not diagnosing it. We're just going to put a Band-Aid on it until you go see your primary care physician, which month and a half, 2 months till I could even get an appointment with a primary care physician. So I'm like, and of course, everybody's giving me all these ideas, and I greatly do appreciate it, and I know you guys will give me ideas too, and I do appreciate it. What I am learning, you can go into an in-care patient, which will kind of, basically, you would go in with a cut in the middle of the night, they fix it, now go follow up with your primary care physician. Same way kind of with me. Okay, we can give you medication to get rid of the symptoms. We're not curing it. We're not saying this is the problem. We're just putting a Band-Aid on it until you can go see your doctor, and then your doctor from there will say, okay, go see this person, or this person. So, somebody suggested, go down to St. Luke's Hospital, the emergency room, talk to them. All right, cool. Today, went down to St. Luke's Hospital. It's a big hospital association all around here. Walked in and I spoke to the lady. Very nice lady, very friendly lady, very knowledgeable lady. And I just wanted to talk to her and ask her if St. Luke's in Manila has anything to do with the St. Luke's here in Pennsylvania, United States. And she said, no. She goes, they might carry that name St. Luke's, and other hospitals and stuff might carry that name St. Luke's, but they are not affiliated with the St. Luke's in our region that I live in. So I said to her, told her what I'm doing. I'm here for a month. I'm trying to get in to see a doctor. Basically, she told me the same thing. She said, we could bring you in, go over your symptoms, give us our doctors could give like a possible diagnosis. However, you still got to go see your primary care physician so you can get more advanced treatment. And I said to the lady, I said, I have insurance. Gave her the name of my insurance. She said, I'm very familiar with that insurance. She said, it's a good insurance. And we were talking, and she said, now your insurance has like a worldwide umbrella. In other words, no matter where I go in the world, my insurance will cover me. You guys hear the bullfrog? My dad got I got the pond going for my dad, and there's a bullfrog in there. Burr, burr. So she said, here's what you should do. When you go back to the Philippines, she said, go to St. Luke's. Go to St. Luke's. They should accept your insurance because it's a worldwide umbrella coverage, no matter where you're at. She said, get your approval from your insurance company. And like I said, this lady was very smart when it came to insurance. She said, and let your worldwide insurance plan that I have cover me overseas. She goes, you're not a citizen or anything in the Philippines. I said, no. I said, I'm a visa holder, a permanent resident holder, but I'm not a citizen. I'm still an American citizen. She goes, sad to say, but that would be your best option. She said, things are so difficult here and so confusing here when it comes to the insurances. She goes, that's what you should do. She goes, I don't know what your healthcare treatments are like in the Philippines, but she said, that'd be the way to go. I didn't think it would be this hard. I didn't think you basically, if you need treatment and you can't see your doctor and this, that, or the other, basically just fall over and die, and I guess now you're cured. But wow. And like I said, I had a lot of people here saying, try this, try that, try this. Everybody fails to realize that you have a primary care physician. And that's who you go to. And from there, they'll say, okay, go get this test done, go get this test done, go get this test done. Wow. It may be different. Maybe some of you guys out there that have like Medicare, you know, you're 62, 65, you have Medicare back in the States. Maybe it's different. Maybe if I would have contacted a doctor prior to coming over and saying, okay, are you accepting new patients? I want to set up an appointment to come in, 2 months after I can become a patient of yours. I'm coming in from out of country, but who knows? Who knows? Like, I couldn't go to a doctor right now and say, hey, prescribe me some medication for my diabetes. They would want to see me first as a patient, go over my medication, and then from there, give me my medication. Hang on. All right, guys. Where was I? So I guess that's what's going on. I did have a couple friends even tell me, hey, good luck. Good luck when you get back here. I just had a good friend of mine. He said it took him almost 2.5 months to see a doctor, to see his doctor. Yeah, is it good health care? Yeah, I'm not going to say it's not good health care. I'm not going to say it's terrible health care. It's just, it seems like, unless you're here, you guys got to remember that if you're away for a while and you need to come back, you better check into all these things. Like I said, maybe Medicare might be completely different. I had a friend who was in the Philippines, had heart issues, he was over at Clark Medical. Then he went to another heart institution. And then from there, he came back to the States. Now, he may have had lined up everything he needed with phone calls, insurances. I know he's over 65, so he probably has Medicare. I'm sure he lined everything up before he even left the Philippines and went back to the United States for his treatment. This is all new to me, guys. Back, in the Philippines, go to the hospital, go to the doctor. There's no primary care physician. Walk in, get a number. Here I am. What's wrong? Okay, treat me. Do this. Here, completely different, as a lot of you guys know. I'll keep trying. I'm not going to give up. I got other people kind of trying to figure stuff out for me. That's what it is, right? I mean, it's sad that my insurance company they're not saying it, but for me to use worldwide health insurance, because I'm back in the States, so now I'm not basically worldwide, I'm back home in the States. For me to use my worldwide to be covered overseas, I'd have to get treated. Welcome to America. It's funny, I see the geese. Can you hear the geese? The migratory geese are flying over. Guys, it's been 50s in the morning, little chilly out, in the 70s all day, lower 70s. I'm wearing this thing, everybody's looking at me, and I know I'm cold. But there's my update, guys. I know you guys are going to leave comments below. Appreciate the comments, but it just seems like get yourself a what do you call it? A doctor. your primary care physician, and once you get a primary care physician, you're good to go. Do a walk-in, they'll fix you, they'll band-aid you on the spot, and then tell you to go see your primary care physician and go from there. So there it is, guys. There's my update. I said I was going to go up to the cabin this weekend, my brother's cabin. Rain is coming through. I mean, if you didn't guys see it, there was a massive hurricane, typhoon in the Philippines, hurricane in the States, rolled through Florida. It's working its way up the coast, and it's just going to rain. So no sense going up there in the rain. I'll be here for another 2-3 weeks. We'll head up there. So, all right, guys, thanks for following me on this journey. Thanks for sticking with me. Everybody at home is doing good. Hannah Grace, Lut, and Bing Bing, everybody's doing good. It's 5 o'clock in the morning there. It's 5 p.m. here. So with that being said, guys, we'll talk to you later.